Sherry McInerney from Croaky here, and I'm talking to Gunn Heatta, who is a Sami woman and a health leader from Norway. But if you could just introduce your title and your health service and a little bit about the background of the Sami people, because you've been very surprised really to find out that they're not that well known here.
Mun namale Gunn Heatta, mulen saanaga joodi heitsi. As you said, my name is Gunn Heatta, and I'm the director of the Sami Norwegian National Advisory Unit on Mental Health and Substance Use. It's very long, so we call it shortly SANKS. I'm a Sami woman from the northern part of Norway, originally from a reindeer herder family, and I'm married, living in Kautokeino. I have 2 kids, 2 girls, and 4 grandchildren.
Congratulations.
Thank you.
You talked about how the Sami as indigenous people have not experienced the same sorts of issues, particularly around violence, as many of the indigenous communities that are represented here at the conference. But you said there are many challenges that you face as an indigenous people. Could you just sort of briefly outline them?
Well, the Sami people are residing in Norway, Finland, Sweden, and Kola Peninsula, Russia. And of course, it's different for the Sami people in Russia than in the Scandinavian countries. The Sami people have had quite a hard assimilation. It's been quite a hard assimilation and suppression during many years. So it's an I think you have to stop. It's a extinction of languages and culture. That's one big issue for us. It's a lot of really, it's like this, that most of the Sami people don't speak their own language anymore. They lost the language, and a lot of Sami people don't even know that they are Sami people, or don't want to tell that they are.
And why wouldn't they want to tell?
Because it's been very shameful, you know, like before the Second World War, they used to measure our skulls and say that, you know, we were inferior, we were not really like people, you know, we were the lowest on the scale. So it's been very shameful to be a Sami. But now the younger people, they are coming forward, and a lot of young people are now finding out that they are Sami and talking about it and telling about it. And it's not always that the family like this very much.
Now, you presented just here a little bit earlier at the conference about 2 programs that you wanted to highlight as particular ways of focusing on the strengths of Sami culture to achieve health gains. Can you just describe them?
Yes, it's 2 methods of treatment that we have developed and adapted to the Sami culture, and it's basically to use the nature very much, but also with a focus on Sami values and norms. Like one very important Sami value is what we call Ersbirget, is to manage on your own, to be able to manage on your own. It's very important in the Sami culture. And then, for example, we use that with adolescents. We take them with us out in the nature. Could be that in the winter time we are making a snow cave and they are going to sleep in it during the night. And this can also be very important to survive if you are out in the winter time and you can't come back home or something like that. So we are using nature, you know, to heal and to give treatments in another context. It's also very important because when you are coming out in the nature, then it's not the therapist who is the expert, it's the family. So then you can use time, you know, it's the family steers the pace, you can use more time, and you can see the family in another context, and it gives you some other ideas about the family. You see other things.
These are programs mostly around substance abuse.
Substance abuse and mental health, yes.
And you said there is very much an extended family approach to that because family is much more important in Sami culture.
Yeah, the Sami culture is the family is much more extended than the Norwegian family. You know, we talk like my cousins' children. I'm the aunt. In Norway, in Norway, they wouldn't call me that, but in the Sami family we do.
And so could you describe how might that manifest if there was a mental health issue that you were dealing with, where the extended family would be involved? How would that work? Because you said some interesting things. One was about the Norwegian system where you don't lose pay in circumstances like that, but also in the idea that schools are very much a part of treatment. Can you just sort of just describe how that would work?
I'm not sure I understood the question now.
I think you said when you take family away and you put them together, number one for the adults, and this is under the Norwegian health system, I think, that they don't lose pay for being in a...
No, they don't lose the pay, It's the Norwegian system, you know, that when you are going to treatment, you know, if you are going to a treatment that takes that long time because they are staying, like in our family unit, they are staying for 4 weeks. Then, you know, they get paid, like they get sick leave. A doctor writes a sick leave for them, so then they have money, the same wages like if they were working.
But you said then they take the children, and it could be...
Is the children, is the siblings, could be grandparents, could be that you are divorced, so it could be your husband and his new wife, you know, and their children sometimes. So, and they all get then paid, you know. They all get, you know, a paper saying that they are on sick leave if they need.
And there's a focus on school for the kids who are there while they're there.
Yes. The kids, they're going at our school. We have our own teachers. They're going there. And it's often kids that have problems in school because of mental health or something like that. So then our teachers, they talk to the teacher back home, so they prepare, so they know what they are going to teach or how they are going to work, what the kid need to learn or to practice. So and then of course the teachers also uses the nature more, you know, do things in different ways, so
that builds strength too.
Yes.
So how do you measure how well these programs are working? What do you look for to actually determine?
Well, let's if I think about the adolescents, the things that we want to give the adolescents is a feeling of mastery, that they are going, when they are leaving us, that they are going to feel that they master something, you know, that they are stronger, that their identity is stronger. So because they very often have unsuccessful experiences in their own lives. So,
and you said not all is positive, that there are frustrations in working in the system for you, and one example you gave was that the system doesn't really allow elders and traditional healing to be involved in that. Can you sort of expand on that and say why that is happening and what you're hoping to do?
You know, like in Norway, it's a welfare state system. In the welfare state system, it's very important that everything should be just exactly the same. And when you are indigenous, that's not good enough, you know. We want the result to be the same, but we can't do it in the same way. And this is very difficult to explain in Norway. So also in our hospital trust, which is our like owners, it's very difficult to say that we need to do things in another way. No, you can't do it in another way. It have to be just exactly the same, and we're going to measure the same things, and that's quite frustrating. We are now working very hard together with the Sami Parliament to enlighten the ILO Convention 169. We are saying all the time, the ILO Convention 169 says that we have a right to decide what's best for us. We have a right to decide things that concerning us. Why don't you take us with, when you are going to do these things? So it's like quarreling, And I can tell you that last night I got one email that our regional hospital trust and our hospital trust, they were making an agreement now on how they were going to organize the treatment to the Sami people, and they were going to do it without us. So I wrote back, I got really angry, and I wrote back and I said, what's this? You're going to do this without any Sami involved. It's two people from the Norwegian system who is going to do this. And then they say, well, it's not about the treatment, it's about the organization. And I said, so what? This is very important for us. So all the time we have to argue and press and for the right to decide, to be a part in the things that is concerning us.
I wonder, you've probably heard very similar messages across in various sessions here, but I'm wondering what it's been like for you to be part of this conference and what your takeaways from it are.
It's been very important to be here, and of course I've heard similar things, but I can also say that I have heard things that's better here. Like it was one who was talking about that if an institution make an offer a treatment and says that, well, we do it for Aboriginals, it's like this and that, they get 30% more paid for that. That's very good, So that's one thing that I will take back with me. But I've heard a lot of things. Ethical rules for research is one thing, and also the Truth Commission, the chief little child. That's also one thing that I think that we have to do, because as I also said today, I don't think that we really have realized how big consequences we have from the assimilation that we have gone through.
And you did refer, by the way, to another aspect of that has been loss of land for Sami people,
yes.
And also that climate change, of course, is an additional issue for you. What are you looking at there?
Well, of course, reindeer herders, they feel a lot of press and stressors about the mining, tourist trade, all the time. They're taking land.